Welcome to Module 2. Today we are going to continue our talk on invasive fungal infections, more specifically the most common and medically important fungi. Our learning goals at the end of this module are for you to be able to listing the major causative organisms for invasive fungal infections and their modes of transmission, also to explain the disease's pathogenesis, and finally describing their possible complications. Invasive fungal infections affect different in our bodies. These includes organs such as the lungs, blood, candidemia, liver, urinary tract, brain, the skin, hair, and nails or mucous membranes. Some of these organisms are opportunistic, meaning that they usually only cause disease in people with weakened immune systems, or those at risk as mentioned in Module 1. The symptoms depend on the part affected and the kind of fungal infection or causative agent. Unfortunately, invasive fungal infections continue to exert a significant burden on human health and are associated with excessive morbidity and mortality. The clinical challenges posed by these organisms are many and changeable, and patients who are at risk of invasive fungal infections often have multiple comorbidities. First, understand the anatomical areas commonly affected by fungal infections and the pathogens involved. The most common medically important fungal pathogens in resource-rich healthcare settings are Aspergillus species and Candida species. From a global perspective, Cryptococcus neoformans is a leading cause of infectious morbidity and mortality, with an estimated 600,000 deaths per year. Additionally, a variety of endemic fungal diseases might also be encountered in Africa, especially histoplasmosis, blastomycosis, pneumocystis pneumonia, and others. Fungal pathogens primarily use direct contact and/or inhalation route for transmission. Firstly, dermatophytic fungi as Candida infect the damaged skin through direct contact, while the other predominant route for transmission is by inhalation of spores/Canidia that instigates pulmonary infections. Blastomyces dermatitidis, which causes blastomycosis. Histoplasma capsulatum, which causes histoplasmosis. Pneumocystis jirovecii, causative organism of pneumocystis pneumonia. Aspergillus fumigatus, causative organism of aspergillosis, Cryptococcus neoformans, and Gattii, both of which are causative organisms of cryptococcosis. All are mainly transmitted through inhalation. Here in this figure is shown the possible routes of transmission of fungi, whether by inhalation of direct tissue contact, and also shows some possible consequent complications.